One small spiral-shaped bacterium is silently living in the stomach of almost half of humanity. This bacterium is the main cause of gastritis, stomach ulcers, and stomach cancer worldwide, and it is called Helicobacter pylori. Even the Nobel Prize was awarded because two doctors drank this germ themselves to prove it causes ulcers. We will talk about Helicobacter pylori signs and symptoms because it can infect literally everyone silently. And if you treat them correctly, you will avoid important complications later in life, like ulcers and even stomach cancer. 50% of population are affected by Helicobacter pylori, but only 25% of them will develop any signs or symptoms. The most common sign of Helicobacter infection is burning or gnawing ache in the upper stomach, especially when hungry or at night or hours after meals. Bloating when person has feeling that the stomach is full of air. Frequent belching when person says, I burp a lot, especially after meals. Nausea, which is not always with vomiting or loss of appetite. Also, bad breath can be sign of Helicobacter pylori infection. Despite brushing teeth, bacteria can produce ammonia. When pain worse on empty stomach and relieved by eating, it's a classical sign for duodenal ulcer. When pain worse after eating, it is classical sign of gastric ulcer. H. pylori is special because it can survive in stomach acid. It can damage the stomach lining and live there for whole life. Most people get Helicobacter pylori in childhood, often before age 10, usually from family members. It stays in the body until you treat it. It slowly damages the stomach even without obvious signs and symptoms. In addition, Helicobacter pylori is officially classified as a carcinogen, bacteria that directly cause cancer. That's why if a person has Helicobacter pylori, treatment is required to eradicate it from the body. After eradication, the chance of getting infection again is low. It's possible, but rare, around 2% per year after treatment. Helicobacter pylori is responsible for almost 80% of gastric ulcers and almost 90% of duodenal ulcers. When you hear ulcer, it is most often Helicobacter pylori. Also, in gastritis, in most cases, the cause is Helicobacter pylori. If it's gastric cancer, almost 70% of cases, H. pylori is responsible. But only 1 to 3% of people who are infected with H. pylori will develop gastric cancer. So, if a person already has gastric cancer, there is high probability that he or she is infected with H. pylori. But if a person has H. pylori, it does not automatically mean cancer. It means increased risk of gastric cancer. The most accepted diagnostic test for H. pylori is urea breath test. It has high accuracy. The stool antigen test is also reliable and easy. Endoscopy with biopsy is gold standard when ulcers or cancers are suspected. On the other hand, bad breath, when oral hygiene is good, can be suspicious for H. pylori, especially if there are also other gastric symptoms. Now let's say what is urea breath test. It is procedure when the patient drinks special fluid or capsule that contains urea with carbon isotope. If Helicobacter pylori is present, the bacteria produces urease enzyme. It breaks down this urea and releases carbon dioxide with isotope. The carbon dioxide is absorbed into blood, goes to the lungs, out in the breath. Then the patient blows into a bag and the machine checks if isotope is present. The procedure requires around 30 minutes in total. Endoscopy with biopsy is not recommended for everyone. It is recommended when there are serious symptoms like bleeding, vomiting, blood, black stool, melena, unexplained weight loss, or anemia. And also when there is suspicion of ulcer or gastric cancer. or when treatment fails and infection comes back. First-line treatment of Helicobacter pylori is triple therapy, which is standard eradication treatment. First is omeprazole or lansoprazole or other proton pump inhibitor PPI. Second is antibiotic clarithromycin. Third is amoxicillin or metronidazole if a person has penicillin allergy. This treatment effectiveness is around 80%. Second line treatment is quadruple therapy when 4 components are used. The first is proton pump inhibitors. Second, bismuth subsalicylate. Third is tetracycline. And fourth is metronidazole. Effectiveness of this treatment is around 90%. The first line treatment lasts 14 days. Omeprazole 20 mg twice a day or lansoprazole 30 mg twice a day. Clarithromycin, amoxicillin 1000 mg twice daily. If penicillin allergy, metronidazole is recommended instead of amoxicillin. This treatment is the first attempt to eradicate H. pylori if the person does not have clarithromycin resistance and is not allergic to penicillin. The treatment usually is successful. The second line treatment is used when the first line fails or if there is high clarithromycin resistance in the region or if the patient have severe ulcer or bleeding where eradication must be very strong. First is proton pump inhibitors twice daily. Second is bismuth subsalicylate 120 to 300 mg 4 times daily. Tetracycline 500 mg 4 times daily. And metronidazole 500 mg 3 to 4 times daily. Duration is 14 days again. Eradication check should be done at least 4 weeks after finishing antibiotics and after at least 2 weeks of proton pump inhibitors because PPIs can cause false negative results. Urea breath test is the most sensitive and specific, about 90% accuracy. Stool antigen test is also reliable. Reinfection in adults is rare but possible and we should prevent it. Hand washing before meals and after bathroom. Clean drinking water, boil or filter. Don't share utensils, food, or cups with infected family members. Treat infected family members if possible. Safe food preparation, avoid raw or contaminated food, and good oral hygiene. People with a long-term H. pylori infection have 3 to 6 times higher risk of gastric cancer. After eradication, this cancer risk drops around 60% compared to those who remain infected.